It's very significant receiving this award. I've looked up to many of my colleagues, nurses, doctors, for almost the 5-6 years that I've been working here. And for them to feel that the work that I'm doing and have been doing deserves to be recognized in this manner means a lot to me.
The biggest honor for me is that it comes from the staff and they recognize what I do with them and for them. It makes me very proud and it makes me want to do better.
It feels an honor, actually, to be nominated for the award. I really wasn't expecting it, so when my supervisor called me to tell me, I was speechless. It makes my day, actually, like when the nurses tell me, like, thank you for everything you do, or the patients tell me, oh, thank you.
I'm very thankful to my staff to recognize me as the advanced practice, but I also have to say this award to me, I feel it's belonged more to them, because without them, I would not be able to do my jobs. The unit itself and my leadership team gave me the opportunity to actually be part of leadership and able to be part of education department to actually work with the PICU team, and it's been a great journey for me, and I really appreciate the experience, the learning. You never stop learning. That's how nursing is.
I'm just thrilled to be recognized by my peers, that they see that I'm doing a good job and they see how hard I am trying. I started a year and a half ago. And when I think of how much I've learned and how much confidence I've gained, I feel so grateful for the people around me for helping me to get to this point.
And the fact that my peers have recognized me for this award actually makes me feel even more honored, because we work very well, and I'm always feeling like we're all, this award also is partly for them as well, because we work so well. Like we're one unit, we're not one person.
Cool. All right, thanks.
You're welcome. When you work in healthcare, there's no way that you can do anything alone. You need to collaborate and you need the full support of everybody that you work with, and they need your support.
For about 2 years now, I've been precepting new grads, and I feel that that's a very important aspect of my job. I know that when I started as a student extern here 6 years ago, I didn't know what to expect, and I looked for guidance. I looked for my preceptors and other nurses to help me guide me along, show me the ropes. And this is the way we need to treat each other. And this is the teamwork that we have. And this is the culture that we have here at NYP. I think that teamwork is so strong here is because people realize that we're all doing it for the patient.
Teamwork, it's that's like the heart of our unit. Without the teamwork, we will not be anything, because it's like we're all helping each other, because we have to somewhat look out for each other in order for us to actually get the job done.
So sometimes I feel like I'm not even doing everything. If I know that I'm going to get a difficult admission in the middle of the night, I get the call from the charge nurse, and then all of a sudden there are 4 nurses by my side helping me to order equipment, draw up meds. I've had so much help, and I feel really honored to be a part of the team.
Plus, it's not just one person's patient, it's everyone's patient, so we're all going into the rooms if they need something and the other nurse is busy.
Especially here, where we do get a lot of sick children, and a lot of times it can be accidents where it's unexpected. To have someone come in and speak with them and tell them what's going on, or even just let them cry to you, being able to make that impact with a total stranger is something very powerful.
I will be on the street and parents calling my name, then I turn around, who is this? And all of a sudden they says, don't you remember you took care of my baby 2-3 years ago or 6 months ago? That makes me feel really good.
We become part of their family, and we offer them a caring, compassionate person who is there for them at their worst. And we know the clinical part of it, and we can help them deal with it, the emotional side of it.
Patients are always number one. Whatever their concerns are, whatever their problems are, they're always number one. If I have extra time, I'll go in the room, try to cheer them up, help them feel more comfortable.
The reason why I became a nurse is because I really like helping people, and I really like to treat people the way I would like to be treated, and also as if they were my family member, and they actually respect a lot of that value, how they're being treated.
York-Presbyterian is the #1 hospital in New York, and I have to tell you, the stuff that we do here, you will not find it at every hospital that you actually go. That makes us so proud.
Working in a place that has such a reputation continually drives me as a nurse here to be better than I was the previous shift.
We have one of the best NICUs in the tri-state area, and to be hired here even as a new graduate makes me feel very proud to be a part of all of it. What we can do for babies who otherwise wouldn't have made it, we can really help them and make their lives better. It's amazing.
I come to work trying to do the best that I can every day. I don't do it for an award, I don't do it for the recognition, I do it so the nurses can have the best work environment for them, so they can deliver that quality of care that we need to deliver to these patients, especially our pediatric patients.
It makes me feel very great to be recognized in such an excellent institution as well for being an excellent nurse and for the Clinical Excellence Award. It makes me feel actually very honored.